Children aged 5 to 11 have begun to receive Pfizer's COVID-19 vaccine. About 28 million kids are now eligible for the low-dose shot after the CDC formally recommended it late Tuesday. Health officials hope this will help prevent outbreaks of the virus at schools. But as Janet Chamlian reports, some parents still remain hesitant to get their kids vaccinated.
Lana, this is where they're giving the vaccine in the hospital, and it's busy. Across the country, appointments at some clinics and doctors' offices are going fast.
It's here, from the privacy of a Georgia pediatrician's office.
All done. It's a game changer for us.
To a large Houston hospital clinic.
It's going to be super fast, okay?
Thousands of parents across the country took their children to get the vaccine on the first day it became available for 5 to 7-year-olds.
Julian here has a medical condition that we've been worried about. Now he's vaccinated, so it's a relief.
The children's version is a third of what older age groups get, with smaller needles and distinctive orange packaging. Millions of doses were already on their way to hospitals, clinics, and pharmacies, awaiting Tuesday's sign-off by the CDC. But while some children quickly receive shots, nearly a third of parents in one survey say they won't vaccinate their child.
For my kids, I probably will opt to not get the vaccine immediately like I did for myself.
Doctors hope hesitant parents will talk to them first.
We can get most kids in now and then get their second dose 3 weeks from now with good protection in time for the winter holidays.
COVID has taken a toll on the unprotected. More than 2 million 5 to 11-year-olds have had the virus. 8,300 have been hospitalized. 173 have died.
That's, to me, feels like way too many for disease, for outcomes that could essentially be eliminated by this vaccine.
Daniela Wilches got the shot at Texas Children's Hospital today.
Almost finished. Okay.
She just turned 5 yesterday.
What made you decide to get the vaccine for her?
We've lost some family members to COVID, and so this has been really important for us. And she has some medical conditions which make her more susceptible.
To give you an idea of the demand, Texas Children's Hospital currently has 38,000 children signed up for shots between now and Thanksgiving. Lana?
38,000. Wow, Janet, thank you. For more, I want to bring in Dr. Adrian Burrowes. He's a family medicine physician and the CEO of Physicians Group. Dr. Burrowes, thanks for being here. How important is it to get children aged 5 to 11 vaccinated against COVID-19? How do you weigh the risks and benefits for parents that are maybe feeling a little bit hesitant or want to wait a bit and see?
No, and I understand the hesitation that parents may have. So we're dealing with a pandemic where children are serving as kind of the primary source of infection. A lot of the times they may get a mild case, but they may give that to a family member or an older adult who may have a condition that puts them at risk for a bad outcome. And so, it's very important that kids get vaccinated. In my opinion, no child should die from COVID. And even though most children do really, really well when they get infected, that percentage that doesn't do well is essentially preventable with the vaccine.
So it's helping to prevent negative outcomes for the kids as well as the people who are around the kids. Should kids who have already gotten COVID-19 get a vaccine?
Yes. So, the CDC director today actually stated that, having a prior infection with COVID-19 in children is not a reason to not get vaccinated. They highly encourage, as do I, that children be vaccinated regardless of whether they had COVID before or not. And the reason why
in this pediatric, oh, sorry, please go ahead.
No, I'm sorry. And the reason why is because we find that the immunity, particularly in children, is much higher post-vaccination than after having an event with COVID.
That's interesting. I want to also ask you about immunity levels following vaccination because kids are receiving a lower dose of the vaccine. Does it still provide the same amount of protection?
Yeah, so that's the wonderful thing about it. So they found that children that were vaccinated with this lower dose, which is a third of the normal dose that the adults take, is 91% effective, which is fantastic. The great part, though, is that because it's such a low dose, the side effect profile, the risk of side effects is extremely low. So that's a wonderful thing for parents that are concerned.
Do you recommend that kids get a COVID vaccine and a flu vaccine at the same time, or is it better to space them out?
That's a great question. So the CDC is clear that you can be vaccinated with both vaccines at the same time. I do know for parents that are concerned, I say there's no problem spacing them, but they can be given together.
Do you think that some schools are going to start requiring the COVID vaccine like we've seen with measles and tetanus? And if more kids are vaccinated, might we see schools start to get rid of masks?
Wonderful question. So yes, I think that you will see some school counties where I believe that they will require vaccinations. And I tell parents, if you have a child that's going to college, they're going to require them to have a meningitis vaccine. Most schools require you to show proof of vaccinations against the diseases you just mentioned, measles, mumps, and rubella. So I do think it's going to happen. I still think, though, that they're going to continue to have masks in schools just for the portion of students that are not vaccinated until we get those numbers up.
One more question for you, Dr. Burrowes, and really appreciate you going through all of these questions, which I know parents like myself have had as we're looking at getting our younger kids vaccinated now. There's a sublineage of the Delta variant that's reportedly been detected in 8 states here in the U.S. as well as in the United Kingdom. Explain what this means and how concerned are you as we're looking ahead?
Yeah, so I want everyone to understand that we're going to continue to see variants in this virus because it's a smart virus that mutates. And this particular strain that you're referring to was pretty prominent in Europe, and now we're starting to see cases in the US. One of the things, though, is that while it looks like it potentially may be more infectious, in other words, easy to get, the vaccines are still working pretty well against it. And as of yet in this country, we haven't really elevated it to a strain of concern as of yet. It very well may follow the prior strains that we've seen where we get more and more cases, but that's yet another reason to get vaccinated. So you have protection against that.
Understood. Dr. Adrian Burrowes, thank you for joining me and thank you for all that you do.
Thank you so much.